So the regular eye exam is perfectly fine for a routine case. So if you're having an update in your prescription, you want back your eye check, the regular eye exam is great for that. A visual skills assessment, which looks more at dynamic eye movements, is more appropriate for kids that might have learning difficulties connected to reading, copying from a board, because if you watch my eyes are moving. If I'm reading, my eyes are moving from side to side. So the routine eye exam was not really designed to look in detail at those types of things. And we've got about 17 different visual skills other than 2020, and you really have to do a deep dive on those. Whereas a visual skills assessment looks at how the brain controls the eye movements, basically. So that's really the biggest difference between the two. So they're not really designed to look at the same thing. I think, especially if your child has an IEP in place, if they have an individualized educational plan. So these are often the kids who are otherwise quite smart. So verbally, they're very intelligent kids. But for some reason, they're not doing great at school. So they're struggling with reading, they're struggling with spelling. They tend to spell words how they sound rather than how they look. I think if your kid is having any trouble copying from the board, finishing tests on time, retaining what they've read is a big one. Because often if you're putting so much effort into your eye movements, you can go through 2 or 3 paragraphs and you get to the bottom and you're like, I have no idea what I just read. I got to go back over it 2 or 3 times. So these kids will often need extra time for tests. They'll have trouble copying that stuff down quickly from the board if they have an IEP in place at school. So the school is giving them extra help, trying to help them out, but they're still not succeeding, and the teachers are scratching their heads going, I don't get it, little Johnny's otherwise a pretty smart kid. The main thing, regardless of the etiology or the cause, is the parents tend to come to us because the child is usually struggling with reading and spelling. And I think if you look in the literature, 86% of kids that struggle at school or have an IEP in place are primarily rooted in reading and spelling. In the classroom, you will probably see symptoms that might actually look like attention deficit disorder. These kids will have trouble staying on task. So they'll get distracted easily, they might get frustrated, they might act out. Or some of the kids who, may hold it together at school and then come home and let loose on the parents because they're the ones that they feel more comfortable around. The most depressing thing I see in the clinic is when the assumption is made that the kid's just not trying enough. And I think while that may be true for some kids, I think some kids are trying very, very hard on their visual skills because they're not where they should be. The kid is basically burning a lot of gas to do the task. So that kid may just also be wiped at the end of the day. So you'll see a very different kid from midday onwards compared to what you'd see in the morning. I would say age 6 onwards, probably 6 to 25, we can do a really good job with that age group in terms of vision therapy and compliance and getting a good result. Patients of pretty much any age can benefit from VT, but that age 6 to the end of high school, we have good data, we know where they should be based on age-matched norms, so we can really pin down what's going on with the child. So some kids may have a problem with their visual system, some kids may have a problem with hearing. It's often assumed that if a kid struggles with spelling and reading, that it's a phonetic issue, and it might be, but a lot of the time it's a visual issue. And I think trying to help the parent and the school and the teacher try to pick that apart and see, okay, is this phonetics related or is it visually related? That's a really important question to answer with the kids. The number one thing is there something going on with the ability of my child to control their eye movements? So if I'm converging or looking far away or tracking. So do my child's eyes team together properly and move together appropriately, even if they see 20/20 on the eye chart, right? Number one. I think number two, how is my child processing information? So if I'm looking at something, am I able to store it and retain it? So if you say to somebody, spell a word, future, for example, and they say F-U-T-U-R-E, you say, okay, spell it going backwards. Most people, the first thing they'll do is they'll look up and try to picture the word in their head and go E-or-U-T. So that ability to visualize is critical for a child's ability to retain what they've seen, which is important, not just for reading, but also for math, if you think about your times tables. How is their near-far focusing? Can they move from distance to near appropriately? So not just in terms of my eye movements, but each eye's ability to focus from far to near quickly, right? That'd be the third thing. And I think the fourth thing is looking at and being able to put a percentile or performance number on their ability to decode print quickly. So basically putting a number on their reading performance. Where are they? Because some parents are like, my child I think is struggling, but they're also only in grade 2. So how do I know if that's normal or not? We can actually put a percentile value and say, hey, compared to 100 kids of your kid's age, your kid is ranking 50th percentile. So 50 are better and 50 are worse. So guess what? Your kid is right where they should be. So you're able to put some metrics on that. So those are probably the 4 things that you'd be able to take away from the VSA. Some kids are struggling because they're symptomatic and the parents are hearing about it. But you also get those kids who are kind of the quiet duck on the pond who looks like they're good, but underneath they're pepping like crazy. So they might be the kid who's getting a B. They're a solid B student, but they are working like crazy to get that grade. So whilst the VSA assessment is of great value for kids with IEPs and they're struggling with reading and tracking and spelling, I would say, if your kid is kind of like middle of the range kid and you're sitting there going, I don't get it. Like I have conversations with my kid and they're up here, but academically they're kind of in the middle and not bad enough to fall through the cracks, but I think there's something not right. Those kids can often significantly benefit from these types of assessment and actually often respond faster in therapy because if there is a problem, it's not as bad, but it can be fixed easier.